Hi, I'm Margaret Martin, I'm your guide, and today I have the opportunity of interviewing José Zilil, who is clinical nurse specialist in Montreal at Hôpital Jean Talon and Hôpital du Sacré-Cœur, both located in Montreal. And she was at the NOF conference presenting several papers, and one of which we'll start with is looking at a systemic fracture liaison that they developed within the hospitals there. So a lot of the practitioners that I've trained are physical therapists in the Montreal area, and I know they would love to have something similar in their hospitals. And so maybe if you would like to share what it is that you did within these hospitals for the listeners.
Okay, so it all started with a care gap that was about 12% of the patients that would come in the orthopedic clinic that would get a treatment for the underlying osteoporosis of their fracture. So we wanted to develop a program that could be run and the patient could be managed by a clinical nurse specialist, because orthopedic surgeons are very busy and it's not part of their practice. So the goal was to have the patients investigated and initiation of medical pharmacological treatment. So we started in 2009 to develop the program, and we validated the algorithm by recruiting 543 patients, and that started in July 2010.
Great. And so you've gone through the study, and would you mind sharing a little bit of your findings?
It's still ongoing.
Okay.
It's still ongoing because we're going to follow these patients over a 10-year period because we want to see the incidence of subsequent fracture when patients are enrolled in a management program. So, but so far we have about 115 patients that have 18 months follow-up done. And so we came here to show data on their persistence to treatment, on their quality of life and functional outcome, and also on the validation of the algorithm per se.
Great. And obviously if you're going to continue to the 10-year period, you're seeing positive results in all those parameters.
Absolutely, absolutely. We have a good persistence rate compared to the literature, compared to the everyday practice. The patients are persistent to close to 60%. It's very good. And the quality of life, I don't know if you want to address that now.
Actually, we'll address that in a separate blog.
Yeah. Okay, sorry.
That's
and
okay.
So we're very happy with the outcome. The patients are very happy as well. They feel they're well taken care of. And what's more important is that we improve the accessibility of care for the patients. And we have a best clinical practice.
And
yes.
So thank you very much for sharing this information
You're
with us.
welcome. Thank you.